Recently in the United States, the Centers for Disease Control funded a study, a population level study in 18 counties, where 18 counties were randomly assigned to get this parenting system. It wasn't just one course, it was all these variety of things that could be done. In those 18 counties, after they were assigned, they sent in teams of people to train doctors, nurses, clergy, school teachers, community youth leaders, just hundreds of different people to deliver these parenting supports. And after folks were trained, and after they were accredited, then they turned on a marketing thing to make this available. They promoted these practical solutions in those communities. They were in the newspaper, they were on the radio, they were in church bulletins, they were in school bulletins. And none of this was aimed at those families or those problematic circumstances. It was made available for everyone. And the most interesting thing about this study was after about 18 months, and they provided no money for the parents to visit and get these resources. They only provided the money for the training. What was discovered, for example, and this is the state of Ohio, if we applied this study to the state of Ohio, the state of Ohio has 1.5 million children between the ages of 0 and 9. And in 2006, 27,000 cases of child maltreatment were substantiated and reported to the federal government. And there were 4,400 children who were sent to foster care. If we did this universal parenting support in the state of Ohio, 3,794 fewer cases of child maltreatment would be substantiated. Now, it doesn't take a rocket science to know that reducing child maltreatment makes the entire society safer, and it will even affect your health care dollars. You may or may not have heard of something called ACE. That means Adverse Childhood Experiences. And in California, at the Kaiser Permanente HMO system, they have been studying people in their HMO who have had adverse childhood experiences, for example, being abused. Only 10% of the people in the HMO system in California have had adverse childhood experiences, which includes child maltreatment. But they account for 20 to 25% of the total medical expenses of Kaiser Permanente. And that is because exposure to those experiences releases stress hormones that actually changes the expression of the genes in the body and creates susceptibility to virtually every illness that I listed on that little pyramid. So you can imagine every year we could have nearly 4,000 fewer children with substantiated child maltreatment. That's not all. Oh, by the way, that would save, assuming each case cost about $9,000, which is the lowest national average cost to resolve, that would save the state of Ohio $34 million, which is more than enough money to pay for this entire discussion that we are having today. Now, let's take the cases of children sent to out-of-home foster care placement, which is one of the most significant and heart-rending expenses that a state government is faced with today. This would save about 1,100 kids from going to an out-of-home placement, and if we assume that it costs $22,000 per year for the child for out-of-home placement, that's medical expenses, legal supervision, etc., which is again a very low national average. Ohio is likely to be larger. That would save $24 million. Again, that savings alone would be sufficient to more than pay for everything we're talking about today. There's one other area in which this universal system of parenting support significantly affects, and that's something called lifetime conduct disorders. Conduct disorders are the very psychiatric diagnosis that predicts lifetime involvement in crime, lifetime substance abuse, vehicular accidents, theft of employment, all of the kind of wicked things that we don't want in our society. Well, this universal system of supports by PPP in the state of Ohio would avert 4,900 of those kids per year if this were maintained. And each lifetime case of conduct disorders in multiple studies has shown to cost at least $1.4 million each over their lifetime. That would save the state of Ohio $6.8 billion. Now, there's another sort of universal access type protocol that I'd like to mention to you called the good behavior game. This was invented by a woman I know who was a teacher when she was a 5th grade teacher in her first year teaching. She wasn't prepared for what she was walking into, and she had the classroom from Hades. You can fill in the blank on that one. And all the other teachers had taken all the other good 5th graders, and she got the rejects. Well, by November, she was willing to quit teaching, and fortunately, she happened to go visit a man named Montrose Wolfe, who was one of my PhD advisors, and Dr. Wolfe helped her see the possibility of finding a solution to reduce their behavior. That study was published in 1969 called The Good Behavior Game by Harriet Barish, Muriel Sanders, and Montrose Wolfe. And at Johns Hopkins University, where I am a co-investigator, we have been following the impact of that game with classrooms being randomly assigned to use that game and very troubled children randomly assigned to classrooms to experience that. What I can tell you is that that game almost immediately reduces problematic behavior in the classroom, and Muriel Sanders, when she came to Hopkins, told the story of how it affected her classroom. But it also has long-term consequences of reducing special ed placement. It reduces conduct disorders in 6th grade. It increases high school graduation, and it reduces lifetime psychiatric disorders, and it reduces lifetime substance abuse, such a 75% reduction, for example, in cocaine use in the lifetime of a child. We follow children from 1st grade now who just got it in 1st grade to the 25th year of life. Now I know that sounds like it's impossible that that could work. That just is, it's just too good to be true. But remember, the best science has shown that simple things over and over and over again are the most powerful procedures to make a difference. Now that too would make a difference in billions of dollars over time. It most importantly saves teacher stress, but the good behavior targets not the bad kid, but the whole classroom to learn this self-regulation and not to reinforce or laugh at each other's bad behavior. We've tested this, for example, in 43 schools in South Chicago, and this is a sample of those 43 classrooms, and this is data from those 43 classrooms and 14 schools, showing that when you start, the behavior is very high, like typically somewhere around 40 to 50 disruptions per 15 minutes. That's approximately 200 disruptions in an hour's time, and those then drop to about 10 disruptions per 15 minutes, or about 40 per hour, quite regularly in almost every classroom. Now it's composed of some very simple things. It's a universal access procedure in that teachers get to decide whether or not they want to do this. They learn some simple things called beat the timer. They learn some simple cues for transitions, and they learn how to use a mystery motivator using something called the Premack principle. We don't use M&Ms or lottery tickets or free pizzas. We use simple things that the children like to do anyway, like sit backwards in their chair for a few moments, or play tic-tac-toe, or doodle on their desk. Now, this game is composed of very small components, just like the universal parenting system, so that we're always promoting the minimally sufficient strategies, the smallest things rather than a big thing, because people can always ask for more. But if you serve them a big meal, they might push you back and not do anything. But if they try a small thing and it works, then they might get more. Now, this is called evidence-based kernels. These are fundamental units of behavioral influence. You can go to our website at www.paxis.org and download this article for free. It's about 40 pages, published in a very highly reputable journal. And it's with my colleague, Dr. Tony Bigland, who is one of the co-authors of the Institute of Medicine report, and he's also the immediate past president of the Society for Prevention Research.